She's just amazing. Welcome to the Great Reboot. I'm Tori Ryden. As the nation takes on the coronavirus, COVID-19, like an army in full battle regalia, an inordinate amount is being asked of those on the front lines: doctors, nurses, techs, the cleaning teams. 12, 16-hour-long shifts are not unheard of every day, and somehow they keep on going. Many, though, have seen fellow physicians, nurses, and coworkers go from soldier to patient overnight. The majority are not immune from this pandemic. While the national and state CDCs investigate potential exposures in healthcare workplaces, they're also applauding the bravery of everyone responding to this call. To help us better understand what's going on the medical end of things is our guest, Maureen Harpell. She's a nurse practitioner in Naples, Maine. Maureen and her staff have also been making some big changes to help protect their patients and their entire staff. They've been rebooting, as it were, on their end in their clinic, in their offices. Maureen, first of all, thank you so much for joining us here on the Great Reboot. I know how busy things are there.
Tori, thank you for having me on here. I love to share what's going on in our community and in my practice, help keep people safe.
I've been seeing a lot of people driving around wherever you are. You see out-of-state license plates, and people are seeking kind of maybe a woodsy area. I would think, especially in Naples, Maine, they might be thinking, wow, that's a great place to go and kind of put myself, self-quarantine. I don't know the wisdom that is involved there. What is your thinking, and what have you been hearing? What kind of advice are you giving out to people?
We are definitely giving out the advice to stay where you are and no further travel. We're really feeling like people need to be staying close to home and not expose anybody to a potential threat. There are some ideas that we may be infected and not be aware of it. So we don't know who we're infecting. We don't know what possible family members we can infect if we even go visit other family members. So the goal really is stay with who you live with and just stay home. Go out as little as possible.
It's interesting. I heard today that I guess there are different levels of exposure that you may, is it called a downloading or a loading of how heavy of a dose of the infection you receive? And so some people have a kind of a slight exposure, and others have a heavier exposure. Are you dealing with that?
Well, you could think about that. So we ask everybody coming into our practice, have you had a fever? Do you have a new cough? Do you have new shortness of breath or a new sore throat? And have you been exposed to anyone that you're aware of who has either tested positive or been near someone who tested positive for the COVID-19 disease or the coronavirus? So we're trying to get a sense of who's at most risk. If we've all been home, we have been home for 2 weeks, and we have not been in contact with other people, we really can pretty much be assured we are not infected.
So maybe you're home for 2 weeks, you're not infected, but that doesn't give you kind of license to then go out, because you still could be infected.
You could be infected, or you could become infected very easily. So the goal is going to be, if we're going to contain this virus, we need to stop having people who can be host to this virus. And that is the huge piece about staying in our homes. Stop spreading it to the people who are at most risk for getting an illness, a potentially life-threatening illness from this virus. And we know it's here. We had a man in Naples who died recently, so we know it's in our community.
Knowing that, and it's absolutely very sad, but knowing that, how difficult is it for you? I mean, somebody equated it to, going right into the battlefield and not even knowing that you've been shot, that how hard is it for you to kind of go right back in and say, well, here I am, and I'm going to take on whatever I have to face today?
It is actually very frightening, because we don't know which of our patients have been exposed potentially. We ask them all those questions. But, we see people who are ill still in my practice. So if we ask them the questions over the phone first, and if they really sound truly worrisome for having COVID-19, we refer them up to the hospital for testing. We have a negative pressure tent outside of the hospital. They can get their testing done there and put fewer people at risk. The healthcare workers there are wearing full personal protective equipment. However, we don't always know. Those questions are not foolproof. So I'm seeing people with bronchitis. I'm seeing people with strep throat, babies, little ones with croup. So we're still seeing ill people.
Let's talk about, if you don't mind, I just want to ask, well, what are you guys doing? I know that you've taken some pretty big efforts to kind of stop it at the front door. Let's
Yes.
talk about what are you doing at your office that, is really that you kind of started this and said, look, we got to do something, right? How did this all happen? And explain it, if you will.
So we're really going through the list of every patient that's in our schedule every day and saying who really needs to be seen. And if they really need to be seen, again, they're ill, they have something going on that they need our stethoscopes, they need our eyes and their ears, we're bringing them in if it feels safe enough. We are masking, we are washing our hands like you have never seen before. We've always been good at hand washing. We are crazy about hand washing right now. We are also trying to go through our list of patients and saying, who could I serve by doing this information gathering on a telephone call? Luckily, the health insurance companies, most certainly MaineCare and Medicare, have finally agreed to reimburse us for phone medicine because of this pandemic. That has opened the doors to me being able to say, let me call you and talk about your depression since we started new medicine. Let me call you and talk about how your diabetes is doing. So it's saving the patient from having to come into my office at all. Even though that risk may be fairly small, there is definitely still a risk.
Well, I think that's great. That's telehealth, right? We know it as telehealth.
We know it as telehealth. We do not do Zoom at this point, which would be amazing. Because I can look at you right now. You can look at me, both of us from our homes where we're
Right.
self-isolating. But I can gather a whole lot from talking to somebody and hearing about their symptoms. And, well, how is your blood pressure running? How are your blood sugars running? We can adjust medications. And my patients have been so thankful to get those phone calls. And then one woman I take care of, I hope she gets to hear this, is working down in Florida. And so she's staying put. And therefore we were able to do her office visit via phone when she was down in Florida, where she's very appropriately self-isolating.
So that is really great news. It also makes more space for people who really, need to come in. And
Yes.
if you need to send them off to the hospital, you can do it, I would think, a lot more quickly.
I think so. And again, I don't want to have my office be a place where germs are being centered. I don't want my patients to come in and become ill. So the more we can keep people out of our office, the more we can keep my staff healthy. But way more important than that is we can keep our patients healthy. And then our staff is not bringing that back home to their families who could potentially spread it. The whole point of this is stop being a host for this virus. So whoever can stay home, however they can stay home, it's really the most important piece that we can do right now. So anybody stay home.
Well, I think that's the best advice you can give. But I'm wondering if you have other advice, such as, is there anything people can do or kind of prepare to bring with them if they think, okay, I really need to go to the hospital now? What's smart for people to have with them that they could bring in, or what would be helpful? You wonder, people are just kind of showing up, and would it be important for them to have that list of medications they're on? Or maybe you can give us kind of a punch list.
I think that's fantastic. A list of the medications that they're taking for sure, and maybe even just put them all in a bag and bring them right with them, because that takes away that layer of trying to interpret what they're on. The other thing that's really important is if someone thinks they're ill and they think they have COVID-19 illness, call the hospital ahead, because they will plan to meet them outside in the tent for testing. and not contaminate potentially the entire emergency room. So we take it very, very, very seriously when a patient presents with any potential illness. So call ahead would be absolutely number one. Bring a list of medicines and a list of prior medical problems. If somebody is in our system through Bridgeton Hospital, we will have their medical records. So that works out really well. Our medical record is pretty seamless from inpatient to outpatient care, so that we have, including their up-to-date med list. But if it's someone who's coming up from Florida, or it's somebody who normally gets their care in a different system, we really need those medications. I think be prepared that your family is probably not going to come in with you if you're ill. We are, again, limiting so stringently how many people get into the hospital. So except for compassionate care, somebody who's delivering a baby, maybe somebody who's at end of life, we are really going to be limiting that.
I'm wondering how all of you are doing this. How are you helping one another, internally? I'm sure there's a lot of anxiety, and just like you're seeing with your patients, you're only human.
Right.
And,
right.
You got into this to help other people. I mean, but this is really probably, maybe you can answer this. Is this the most difficult thing you've ever been part of in your career?
As far as the width of it and the breadth of it, absolutely. I would say there's been certain, I worked ICU and emergency department for many years, so I have many, many, many stories that were difficult. But as far as impacting our community, our state, our entire country, and in fact, the entire world, this is well beyond anything we had ever dreamed of, truly. I don't think we were really prepared for something of this magnitude. However, I think that we have really ratcheted up. I know New York State is asking for help from other healthcare providers. And as you're saying how frightened we are, there's part of me that says, I should be there. I should be there. I have this experience. They're getting quite tired. So I'm not sure where we'll see that in the next couple of weeks. We may see a cadre of people from our state, which has really been hit fairly lightly so far compared to New York. And we may go down there and offer our services and maybe give some relief that is needed down there. That's very, very preliminary. I don't know how my family would feel about me volunteering to go down there, but I think it's something we all have to think about. They're overwhelmed.
Yeah, they are overwhelmed. You just hit
Yeah.
on something very important, which is something that Governor Andrew Cuomo was hitting on. Look, other states that have not been hit hard, heed the warning, and perhaps these new breakthroughs. Abbott Lab, which has different places in the Midwest and also on the East Coast in Maine, they've developed a test which is 5 to 10 minutes. You could know in 5 to 10 minutes whether you are COVID-19 positive. And so I guess I'm wondering, is that something that gives you some hope that we can stay ahead and keep that kind of the curve flatter in this state?
Absolutely. I think that is immense. What I've been reading is they're thinking that those could start being shipped out within this week, actually. They had April 1st as one of the dates. I'm not sure how easy it's going to be to do. Insurance companies are going to cover it. 5 minutes for a positive test, 13 minutes for a negative test is what I was reading. It'd be life-changing for all of us dealing with this pandemic. We will know who's sick and who we have to quarantine, and we should still all continue our social isolation. But we can then put the resources of our healthcare system where they're really, really needed. Again, this is not always a life-threatening illness, but it's hard to predict who it's going to be. Definitely the elderly, definitely people with other comorbidities are at greater risk, but not all. Not all. We're hearing of people who are getting sick, very sick and dying, who really didn't have significant comorbidities. So I think it behooves us all to be staying as close to home as we can. And if we can test massive amounts of people. You have a sore throat, you have a cough, wouldn't it be nice to say, it's not that, I'm going to go back home again? It's not just healthcare professionals either. I'm thinking of the people who staff the grocery stores and Walmart, I just saw something from a Walmart worker who said, please don't come in with your whole family. One person come in. Don't come in and potentially expose all of us to this virus. So I think that would go a long way towards decreasing the way the virus is spreading.
So I can't thank you enough for joining us for this. You have such wisdom. I'm just wondering, before we let you go, do you have any, you've been ramping up safety measures at your own office. What are you telling your patients? And is there anything kind of more that we're not even looking at that people can be doing?
Well, I think keep your immune system strong. And so keeping your immune system strong means try to manage the stress, which is really important. Get plenty of sleep. Take a good multivitamin every day. Think of staying at home as not thinking of being stuck at home, but being safe at home. Change that mindset just a little bit. It's our opportunity to bond with our children. I'm home with two 19-year-olds. We are doing a lot of bonding here at home on my days off, which is really, really wonderful. Using this as a time to settle down, settle in, and these empty streets are a measure of our love for each other. It's really an important thing to do.
Maureen, if people want to get in touch with you, would you be willing to share any of your email address information if they have additional questions?
Sure. It's Maureen Harpell at gmail.com. My practice is open. You could get information from my email address. And I'm glad to do phone medicine for people if they decide they want to switch over to our practice. But most practices in the state are going to be doing this. So reach out to your own primary care provider and say, I have questions. I'm worried. I have a cough. And we really should have the resources to aim you in the right direction. But just remember all the important things. Stay home. Try to keep that immune system strong. Wash your hands frequently. I actually keep hand sanitizer in the car for when I get in and out of the car, and I put it on the steering wheel as well. We could be carrying those viruses on our hands and not be aware of it. So be very mindful of what we're touching. Try not to touch our faces, which is very difficult. And again, remember, this is a good time to stay home and really connect and bond with our families.
And I have one to add, because you are so good at this, is when you are out and about, be sure to smile at people and be friendly, because everybody's in the same boat and we don't have to turn into kind of hardened people who can't look at one another in the eye.
Exactly. Right? Smile from 6 feet away.
Maureen, all the best to you. And if we need to, I really would appreciate having kind of an open line with you so we can get
updates
love that. On how
absolutely.
Things are going.
Yes, reach out anytime.
And I appreciate all that you're sharing, and I'm sure a lot of people will take some really great tips away from this. So thank you so much, and keep up the great work.
Thank you so much, Tori, for spreading the word to everybody to stay safe.